last time, I didn't think I was going to make it. It was that bad. I have COPD and a heart problem, but it's a combination of both that makes it difficult. And the last time was really bad because I couldn't get my breath, and it just was bad. Each time I was taken by ambulance to the hospital.
The whole thing was just unbelievably stressful, and especially the last time.
She gets upset, and then, of course, I'm normally in the hospital 4 or 5 days.
So the patients get referred to the program through the case managers at the hospitals. They refer them on several different disease processes, COPD, congestive heart failure, coronary artery disease, and pneumonia.
Amy can keep us from that, for me anyway. I know that it's great.
There's no way that the doctors can see exactly what's going on in that patient's home.
She takes the time,
so Mr. Richards,
and she listens,
at your potassium,
and she tells you
4, which looks very
in
good.
a way that you can understand. Good, and she's very knowledgeable. She knows what she's talking about. And we go through all the different types of things that I should be doing. Vital signs. We go through the weight.
The biggest thing that we find is medication errors. Either those errors are an old medication that the patient shouldn't be taking anymore, or they're actually taking a medication that the physician or the hospital was unaware of. We also do a lot of nutrition counseling with the patient, talk to them about the foods that they're eating and how those foods affect their disease processes.
One of the issues after you see a patient in the hospital is that it takes a couple of weeks before we can see them again in the clinic. It's bringing back that concept of the healthcare provider actually going to the patient home instead of the patient coming to the healthcare provider. And these things could not be done if we didn't have access to the CHP program.
I know when something's wrong. I can do something to correct it, where before
prevention is going to save money in the end, and it's much more cost effective to have one person go out in a vehicle to the patient's home than it is to utilize an ambulance.
I'm happy to report that we are still that good little town we used to be, and the essence that you will find of that goodness is in the program that my mother has received with the paramedics. She lives in San Angelo. She's 88 years old, and she became very sick, could not get the care we needed for her there.
You know, sometimes patients get home and they're handed, 3 nebulizers, an inline neb, a nasal cannula, and not really having any experience or wherewithal to figure out how to use all these things.
Several days later, she was released, and I didn't know what I was going to do because I teach school and you've got to teach. And so I was kind of between a rock and a hard place.
Our goal with Miss McKinney was just to get in, and as it is with all of our patients, to get in there and add value to help them from falling through any cracks.
Hopefully we will find that this strategy is in fact improving patients' prognosis. So it's probably decreasing the rate of readmissions.
Paramedics came by every few days. It isn't just that they came, it's the care that they gave, the consistency that we had with the team. They were wonderful, patient, and knowledgeable, and it took time to teach us how to use the glucometer. We just couldn't seem to wrap our minds around that.
From a community healthcare perspective, you're able to get to know people personally. When you know them better, you can really start to look at it on a holistic level. So you can really address it from a different perspective than you can in emergency medicine.
But I truly believe that they helped save her life. And I get a little emotional about it. But I just feel very blessed and very thankful to have them. If we've done anything right in Williamson County, this is one of the things we've done well.